The Ridge Medical Practice, Ebony speaking.
So, have you had any sex without condoms at all
No.
since I spoke to you last? Are you happy if we do a quick pregnancy test?
Yeah.
The problems I've got with my heart, I'm going to die quite early anyway.
Well, but we'd rather it wasn't us that was doing it.
If you're having any symptoms of weakness, headache, drooping of your mouth, you need to ring 999 straight away.
Can he still get tonsillitis with no tonsils?
No, not usually. Has he had his tonsils out?
Yeah, he
oh,
has,
well,
yeah.
you're sorted out, yeah.
You can see it's all sore from there to all.
Yeah. Oh, you're all cut up there, look. Oh, ow, that looks so sore.
Good morning, Zonia.
Come in. Hi, Caris, is that right?
It is, yes.
Come on through. Come and have a seat.
It's all right. It's hard to stand up. It's sitting hurts quite a bit at this moment in time.
That's fine by me,
I'll just
yeah.
stand here.
OK.
Yes.
So what can I do for you?
Basically, my joints tend to click out quite a bit. So last night I was just moving some boxes around. My hip clicked out. Obviously, just kind of a bit of a wiggle to get it back in.
Right.
And it bit achy, nothing too bad. Went to sleep, woke up this morning, and then
Okay.
immense pain. So I've taken naproxen at about 8 o'clock.
Right.
I've tried moving it as much as possible, but nothing seems to be kind of getting rid of that pain, so I can't really do much. So I've had to call into work sick because
Right.
obviously I can't drive or anything.
OK, yeah.
So I just wondered if there's anything else that I can do.
And the pain then, so it's in the back or in the hip?
In the back, mainly. It's
Okay.
right
On
here.
that there.
Yeah.
OK, let's have a look. Can you turn that way? Is that OK?
Yep.
So I'm just going to feel gently down your back
Yep.
if you tell me if I'm hurting you. So my hands are a bit chilly. Is that OK?
Oh, there.
There's,
Oh.
so is it OK? Here?
Yeah, then it's across the bottom there, along that line. That starts to get a lot there, especially there.
Okay.
Yeah. It sends kind of a shooting pain down my leg when you touch it.
OK, it's fine if you want to have a... Well, not sit, but, you know. So, where you're tender is the sacroiliac joint, which is where the nerve does come out.
Right.
Doesn't seem to be any entrapment of your nerve. It seems to be working OK.
All right, OK.
In terms of what more we can do, it's a bit limited, really.
Yeah.
I can give you some amitriptyline if you would like, because that helps with nerve pain. It can help
I've already
with
got
muscle.
some.
So maybe take some now, just see how we go with
So
that.
it's, what I've been wanting to look into was hypermobility, because I have a lot of the symptoms of it, but it's never been kind of brought up.
Yeah. So, in terms of hypermobility, one of the things we look at is looking at thumbs and things. So, OK, so that's...
Because generally, I can do that very simply, very easy.
Yeah,
And then,
but you need to be... But you're forcing... Well, actually, no, that one is more so than this one, isn't
Yeah.
it? This one doesn't go as much. Yeah, OK. And then this way. OK, so it is a bit excess. So they do a bit, not horribly so. Would you like to see someone?
preferably, yeah.
So we have an MSK service. So what I can do is write a letter to them, explain the situation. Now, they may decide that physio is the most appropriate, in which case you'll get a letter. Or they may decide a doctor, and also you get a letter, but it's to go to different places.
All right, okay.
Does that sound OK?
Yeah, that sounds a lot better, yeah. Am I best to keep moving around or am I best to rest?
I would keep moving.
Right,
Yeah.
okay.
Yeah, keep mobile.
Yeah.
All right, then.
Lovely,
Bye.
thank you very much.
Hello. Hello, Noah. So we're just looking at his discharge letter from hospital. A big boy.
Yep.
definitely.
Forceps.
Yeah.
But when they got him out, it was good.
Fine.
Yeah.
Yeah.
You're looking fab though. How are you
I
doing?
don't feel fab. Thank you.
Are you all right?
Yeah, not too bad.
He's a big lad. Has he carried on putting weight on?
9'6" he was. Wow. Now, last time I got weighed, which were about, I think it was 2 weeks ago, he was 12.
Yeah, he
2,
looks.
so,
yeah, been nearly a stone. I bet won't he?
so,
I love him.
definitely, yeah.
But you're tall, aren't you? He's going to be tall, I
Yeah.
bet, isn't he? So does he look at you? Follow you with his eyes?
Yeah, he does, yeah.
Smile at you?
Yeah.
Has he started doing any vocalising, doing any cooing?
Yeah, he does it all the time, yeah. He's done it for quite a while, that, to be honest, now.
Oh, no. Now then,
Typical.
what's all that about? Oh, my goodness me. Look at that. Well, there's not wrong with his flow, is there? There's no wrong with his flow, is there? No.
Oh, no.
And your Auntie Debbie's all dressed up today. Yeah, you've beat on my trousers, you little tinker, you little tinker. Right, so the first thing we think about is his eyes. You've told us he's fixing and following, so I'm going to turn my light off and we're going to look inside his eyes. And he's got you'll see he's got a really bright red reflex, and you can see them both together. So he's a perfect one to look at. So we're looking there, Mum, for any baby cataracts, any problems with his eyes. Mm-hmm. So we feel his fontanelle, that's the soft part of his head. Have you felt it?
Yeah.
Yeah. That'll close up definitely before 2, but usually before the 1. Mm-hmm. Oh, yeah. It's got a lovely round head. Beautifully grown baby, looks really well, breathing completely comfortably, lovely colour. Mum reports how well he's feeding and how much he's gaining weight. He's breathing, no pulling in. Got a brisk capillary refill. We'll have a little listen to his heart. Won't we? Yeah, we will. Yeah, so you can hear his first and second heart.
No.
Blooming number, boy. Speed again.
No, what are you doing?
What are you doing now? It's a good job we don't charge for this role.
Oh, God, it's everywhere.
Oh, it doesn't matter. I'll sort all that out when you've gone. Don't even look at it. Just leave it, honestly. Ooh. Ooh. So while he's talking as well, I'm choosing my time to have a little look in his mouth. A boo, is that right? A boo. Both his testicles are there. We know he wheezes out of the right part of his tail. I always check. Now and again, you can get a hyperspadias that's a really bad one, and they can wee right from base of the penis. Sometimes that can be missed, but obviously we know he's spot on there, don't we? So he's got great head control. Do you give him tummy time?
Yeah.
Yeah, so every day tummy time's good. Keeps their heads nice and round and gets them used to being on the front. He's got a lovely straight back. All done. Yeah, gorgeous. He's gorgeous. Everything looks great.
I weighed myself last night and I nearly died. Got to remember you've got baby in there as well, so baby's going to add a lot of weight onto that.
Oh, don't. I'm so nervous.
Why?
Being a mum.
Being a mum?
Yeah.
Hiya there, come in.
Hi.
Megan and Mum, hiya.
Hiya.
Come in. I've got a student with me as well today, if that's okay.
Right.
So, is your mum, you spoke to your mum about the last appointment that you came in for, yeah? So Megan's come back today to have the implant put in, the contraceptive implant. Do you have a boyfriend? You're not having sex? Because just remember that if you were, the pregnancy would potentially be a risk, yeah?
Yeah.
And we can talk about contraception with you if needed. There's young person's clinics that we run here, so you must remember that. So how's things at home?
It's fine, but me and my mum are off and on sometimes.
Arguments and stuff a bit? Yeah. We just need to be certain that when we put it in today, we can be as safe as we possibly can about you not being pregnant today.
Yeah.
So have you had any sex without condoms at all since I spoke to you last? Are you happy if we do a quick pregnancy test before we put it in today? Is that okay? Yeah, just in case. So if I give you a urine bottle. There we go, okay. So if you go back out to the waiting room and then just come in when you're done, okay? How are things? I met the key worker last week. She's nice, isn't she?
Yeah, she is.
Yeah, and is it working okay with her?
Yeah, it's only just started,
Yeah, so that'll help, won't it? It takes a bit of pressure off you as well, doesn't it?
Yeah, I had to end up getting cups out again last night for the last night because she wasn't home. And she should have been home for 8 o'clock. It was 11:30 when I found her.
Right then, thank you. Do you want to check the pregnancy test? Yeah. Are you right-handed or left-handed?
Right.
So maybe if we pop it in your left arm, yeah?
Mm-hmm.
Cry.
There's this other stuff that we use, which is quite a bit stronger. You mustn't take it if there's any risk of falling pregnant. Are you using any contraception? Are you needing any, or are you not sexually active?
No. Do you think that's for any particular reason? Have you taken some painkillers? Have you done something?
You have took painkillers.
No, I haven't. I took migraine.
Migraine, because he said he got an headache.
Right.
I'm gonna burp.
Don't.
Hi there, come through.
Negative, just one line. Yeah. Right. We hoped it would be, but it's always a relief, isn't it? Yeah.
Yeah.
Well, if you don't, do we know?
Remember, Megan, that once we put this in,
Yeah.
it takes a little while to work. So it takes 7 days to fully get in your system and work properly. So you must use condoms for the next 7 days in addition, and then it's safe just on its own then, OK?
Yeah.
I just put this in. Where's the sharp spin over here? Megan is 14 years old. In young people under the age of 16, we need to consider whether or not contraception is the best thing for the young person. And the way we do this is to consider something called the Fraser guidelines. They include looking at things like whether or not the young person is able to understand what sex is, the implications of pregnancy and what contraception is. They look at whether or not the young person might suffer harm, physical or mental harm, if contraception is withheld. They look at whether or not the young person would be having sex anyway, and importantly, what is in the best interests of that young person. So, you just feel a bit of a scratch, OK? You all right?
Yeah.
So I'll just draw back. You all right there? Does that feel all right?
Yeah.
It's sore. Feels funny, doesn't it? I think this is the worst bit, you know. Is that OK?
Yeah.
Should we get cracking then? Yeah? Good. Excellent. Do you want to watch or are you going to look away?
Come here.
What?
So I can hold your hand.
It's going to be numb. It's going to be numb. You'll
I know,
not feel it.
I just don't want to look anyway.
OK, you ready?
Yeah.
Well done, there. That's the worst bit.
Look, blood come pouring out.
No.
No.
No, it won't come pouring out. Have faith in me. There we go. Look, you feel that?
It feels like there's just a needle inside me.
It's like a matchstick, don't you think?
Yeah.
Perfect. Fabulous, done. OK, so you can pop your arm back in your sleeve now. OK. You all right?
Yeah.
Yeah? So that's it, done for 3 years.
Thank
Any
you.
problems, give us a ring.
Yeah.
OK? All right.
Right, cheers.
Take care, thanks for coming in. Bye-bye.
Hello, ladies' toilet, first cubicle. There is a huge spider. Yeah, it's absolutely massive.
It's a bit of a tricky situation.
Oh. Sorry, I won't be a minute. I don't really want to go in, Harry, because I'm petrified. It was on the wall there. No, have you looked properly? Because a very elderly patient nearly had a heart attack.
No, it's not in here.
Where's it gone?
Well, I've gone in the cup and cranny somewhere.
Oh, well, thank you anyway.
So what can I do for you today?
It's a medication review. I need some Tramadol, but they won't give me them without seeing you.
Right.
It's about the pain relief.
So whereabouts is the pain that you've been having?
It's in my back of my legs. I had another injection at St Luke's yesterday for it.
Okay, right.
But it's the first one I've had in 2 years because of my heart.
Right, okay.
Now I've had the injection yesterday.
Right.
It doesn't seem to have done a great deal, to be honest with you.
Okay, although it does sometimes take a little
Yeah,
while
well,
to
they said
kick
it takes
in.
up to 72 to 96 hours to get in.
Yeah, okay, right.
I just need my Tramadol.
Okay. So with the Tramadol, how many tablets are you needing a day?
I usually take about 4 a day.
Okay, right.
4 times a day is what I usually take.
And do you use any other painkillers at all?
Yeah, I take them in conjunction with paracetamol.
Okay, and how much paracetamol are you using?
I have 500 milligrams. I have 500 milligrams
Yeah.
of paracetamol and is it 50 milligrams of Tramadol?
Okay.
4 times a day.
Okay. So we can issue it, and I will issue it for you. I think the main thing is we want to talk to you about it because there's been a lot of research done recently about the risks of taking Tramadol, and we just need to make sure that you understand those risks.
Yeah, fair enough.
So what we now know is that people who are taking it long term for things like chronic pain have a higher risk of dying than people who are not on it with the same problems, same other health problems.
To be fair, the problems I've got with my heart, I'm going to die quite early anyway. I think.
Right. Well, but we'd rather it wasn't us that was doing it.
Yeah, well, fair enough. Yeah,
All
fair
right.
enough. But I mean, like I said,
Yeah.
I'm not really bothered about the risk of dying a little bit earlier than other people because the probability is that I'm going to die earlier anyway.
Right. What we also know is that people that are on it for a long period of time, it can change the way that you feel pain. So people, especially when they're on higher doses, it actually changes the pathways. So your brain can feel pain even when there isn't pain there. And so it actually can make pain worse in the long term.
Makes you want more.
Well, not just want more, but you actually feel pain. The bit of the brain that recognises pain, it has false signals because of the medicine. So the medicine sends false signals to it. So...
Feed me.
Yes, basically.
Yeah.
So the less you can take, the better. If we can wean you off it, that would be great. I mean, I don't mind prescribing for you because I can see you've been on it a while, but you need to understand that this is the risks of it and that actually it's not.
Well, to be honest with you, it's the first time I've ever had the risks explained so fully.
Right. I would actually suggest that you take more of the paracetamol so that you need less of the Tramadol. Paracetamol is a very, very safe drug. And it is a painkiller, a good painkiller. So if you take 8 a day of the paracetamol, hopefully that might mean you need less of the Tramadol. And that would be a safer way round of doing things.
Yeah, we'll try that if you want, yeah.
Yeah, OK. Yeah. There you go.
Cheers, love
All
it.
right,
Thank you
take
very
care
much.
then,
Cheers,
bye.
Hello. There is a huge spider. It was like the size of a cat. So I'm warning you. Have you got big shoes on?
No, I've got my sandals on.
Good luck.
Sure you weren't dreaming?
I'm positive. I would not dream. I mean, if it's gone, it's gone.
It's gone.
Well, I'm really pleased that it has. However, where has it gone?
I will keep my eye on it. All right.
Thank you.
Come and take a seat, please. How can I help?
I keep getting blurred vision and going dizzy, and every so often I get pins and needles and numbness in my fingers and my lips.
And how long has this been happening for?
2 or 3 weeks now.
2 or 3 weeks?
This last week it started getting pretty bad. I just keep going dizzy.
What brings on the blurred vision?
Just happened.
How many times is it happening in a day?
At least once, maybe twice. I think it were Tuesday it happened about 3 times.
2 to 3 times a day?
Yeah.
Every day for the last couple of weeks?
Yeah, but the numbness and pins and needles sort of thing in my lips, that's only happened this last week or so.
Any family history of strokes or anything like that?
No.
The symptoms that you're describing are a little worrying, especially with the blurred vision. And the dizziness, how long's that been going on for?
About 2 or 3 weeks. I went for my eyes testing and they said they're fine. They give me reading glasses.
Yeah. Any speech problems?
Our wife said I didn't realise it, but she said she couldn't understand me.
Okay, and did you have a drooping of your mouth at all?
It just went numb again, and then pins and needles.
Okay, do you smoke? How much do you smoke?
20 a day.
And are you normally healthy, fit and well?
I'm going through a angina test, and I had an angiogram on Tuesday.
Just take your jacket up for me. From your point of view, what's worrying you about this?
Just bugging me, really.
Just sit towards me. Follow my finger, and if you see double at any point, let me know, OK?
No.
You see double there?
Yeah.
Where?
There.
There?
Yeah.
You seeing double?
Yeah.
OK. Your blood pressure's a little bit on the high side, the bottom number is, OK? I want you to record your blood pressure for 7 days, morning and evening, and if you give the readings back to us, we'll look at them to see if it's always high or if it's just a one-off reading that we've done is high, okay? I'm going to speak to our stroke physicians, okay, to see if we can just make an appointment to see you in their clinic.
Right.
But if you're having any symptoms of weakness, headache, drooping of your mouth, slurred speech, you need to ring 999 straight away, okay? Because it could be signs of a stroke. I don't want to worry you by saying all that, it's just to make you aware of the symptoms, okay?
Right, okay. Right, thanks for your time,
thank you very
Doctor.
much. See you later.
See you.
I'm tired. Do you know this week? Whoa, there's a spider. Oh, God, stand it. Hey, don't let it come near me. You're tiny. Thank you.
Hello, doctor.
Hello, come
Thank
through.
You. Come on, Billy. Come on, leave that bag alone. Thank you, doctor.
Hello. Somebody else with you?
Yes, my sister. She's a patient.
Oh, all right.
Yeah.
Hello, come through.
Oh, yes.
That's the way you're sitting there.
That's not your chair.
Right.
You're going into the doctor's chair.
No, oh, looky, we are going to sit.
Right, what can I do for you today?
Well, doctor, she had a stroke and she was up from London and she's here. She says she wants to go back to London, but I've spoken to her social worker.
Right.
And the social worker need to know her medical background and everything is okay before they do anything. It's no point sending her back to London when she's going to fall to pieces again.
And who's going to be with her in London?
I have friends there around the buildings and I have neighbours.
But you're not going to be there. You're not going to be there no more. They're going to move you.
Yeah, I'm going back to my places to sort my place out.
No, but listen.
They can't go sort out my place like that.
What are you getting upset for? Listen. I say you're not going to be there anymore because they're looking for some way for you to live on a ground floor.
I will be there for a little time till they sort me out. I'm not poorly. I'm not poorly to that.
Yeah.
I can go down and sort it out.
For us to give them all the information, they actually need to send us a request in writing, and then we'll need to check with Milford whether she's happy for us to give all the information to them.
Okay.
So apart from that, is there anything else I can help you with?
Can you check her blood pressure first, please,
Yeah,
doctor,
sure.
to make sure everything is okay?
And she's taking all her medication regularly?
No,
you
doctor.
are taking Milford?
No, doctor.
Oh, dear.
Oh, you know, when I take the tablet, and if I miss the tablet, I'll go back and take the evening one.
Right.
And the night one. If I miss the morning one, I don't go back and take it because I have to take it in the morning.
Yeah, but it's really important that you take your tablets, Milford.
Yes.
Because if you keep missing, then you're not going to feel better. I agree with you. She'll need a full social assessment, won't you? Let's check your blood pressure.
It's high.
You're working at the moment?
I am, yes.
What do you do?
Varied. I work on the bar, I work in the diner, I work at a bingo hall, so...
For my job, I do an awful lot of face-to-face conversations.
What do you do for a job?
Bricklayer.
Okay. What job do you do?
I'm a digger driver.
You mentioned work. What do you do for work?
I'm a plasterer.
Honestly, it took me weeks to find a plasterer. Might make a note of your name and just in case I need you.
I've been a DJ around here a lot of years ago. Loads of people have come up to me when I'm shopping and they weren't you when the DJ? So, yeah, I was, unfortunately.
My name's Debbie. I'm a nurse practitioner. What can I do for you?
I worry about my problem. You know, my work is very active.
What work do you do?
I folding clothes.
Oh, yeah.
And then I worry when maybe I got that arthritis because I have pain here and here. Sometimes I don't have. In morning when I wake up, my legs.
You know the stiff feeling?
Yeah.
How long does that last? 5 minutes, 10 minutes?
Maybe 5 minutes.
Few minutes?
Yeah. I very worry because I think I need to come straight away to you.
Don't worry about it. We can take your blood. We'll do a blood test. That would show us if there was any inflammation.
Yeah.
And otherwise, are you well?
I think I need to take that sertraline, but I stopped. But I find that prescription I need to take because I go to back.
So the sertraline is the tablet for mood, depression,
Yeah,
low mood.
yeah, I know.
So you haven't taken it for quite a while, and if you feel good, then that's good.
Yeah,
If
I
you-
think I need to back
You think
because
you need
I
to go
feel
back?
before I feel normal, but now I feel when
What do you feel like?
stressing. I crying about everybody. You know, I
worrying about.
Yeah.
Who do you live with?
My husband, my.
Yeah, and does he? Can you talk to him about how you're feeling?
Yeah, I don't tell him.
You don't tell him. You know, you said you worry about people. What they
Yeah,
do.
what everybody, people who is live know with me, but what I see, what I know about people, what I reading about people, I all time I watch TV, I crying.
Oh.
I all time cried.
Sometimes when people are feeling low, like you, they
Yeah.
get feelings that they want to finish their own life or kill
Yeah.
themselves. Do you have any thoughts like that?
No.
No, good. That's good. Because you know, if you get any thoughts
Yeah,
like that,
no,
you
no.
need to come back here straight away.
No,
Not
that's
so
very
bad,
bad,
yeah.
because I need to take this.
You want to take them,
tablet,
yeah. So I'm happy to start that again,
Mm-hmm.
and then what we'll do is we'll get you booked in to see you in about 3 weeks
Mm-hmm.
again. Sometimes going for talking therapy can help. You know, you can go and talk to a counsellor,
Yes,
talk about
I
how you're
know.
feeling.
Yeah.
But I don't want you to worry about this arthritis because your hands, because I don't think it is arthritis. We can get you booked in for some blood tests. Is that okay?
Yeah.
All right. If you feel suicidal or
Yeah.
that you're going to hurt yourself, I want you to ring that number.
Okay.
Is that all right, my love?
Yeah, thank
okay.
you, thank
All
you.
right, thank you. Oh, don't take that. See you later, love.
See you.
Bye-bye.
Yeah, bye.
Bye-bye.
Thank you.
Right, you're right, Milford. Your blood pressure is high.
Yeah, because I felt it.
I think it's because you're not taking your medication regularly.
I take it every day.
Well, she's have some in the bag. Show the doctor what you've taken.
So what stops you from taking your medication? Do you
I
forget?
do take it. I take this one.
Yeah. So you need to take the full box.
All these tablets for the day.
No, just one box for the day.
Okay.
It says there on it.
Yeah, I told her.
I can't take so much, doctor.
Have you noticed any problem with the memory at all?
No, it's to take them all. It's too much.
But I'm afraid you'll have to take them, Milford.
Yeah.
Because you've got so many things going on with you.
Yeah.
I'm afraid you'll have to take
all
them
right,
all.
I will take them all.
Well
I will
done.
take all these in the morning.
So is that a deal then?
And this all in the afternoon.
Yes.
And all these in the night.
Yes.
Okay, so I will take them.
And how are you doing at home? Are you coping everything all by yourself, or do you think you need some help?
No, it's all right because I had so much to do there. I want to get up and...
So who does the cooking for you?
She will do a little bit of cooking there.
I don't do a little bit of cooking. I do the cooking.
So you do the cooking?
I do the cooking.
Right.
Because
And is she okay dressing herself?
yeah, but you see, like the gas, she will leave the gas on.
All right.
And like I used to give her a key to open the door. She'll shut the door, but she don't lock the door.
Because that's a bit concerning.
Yeah.
And the other thing is, you know,
Yeah.
I am a little concerned that, you know, we need to assess whether you'll be fine on your own. It might be difficult for you to live all by yourself.
Yeah, I think I'm all right. Still all right.
You think you'll be all right?
I'm still all right. Wasn't it
So
good?
let's get that assessment then,
Yeah.
then it'll be decided.
Thank you, doctor.
All right, look after yourself.
Yes, we will. Nice seeing you.
Same here, bye.
Yeah, bye-bye, love. Bye.
You all right, Milford?
Yeah.
All right.
Thank you, doctor.
Right, girls, what we're getting then?
I don't know. I think I'm going to get a cheese salad sandwich in brown. Yeah.
Cold cheese.
What?
Did you say cheese salad sandwich?
Yeah.
I hate cold cheese. If you like cheese, then you're going to eat cheese, aren't you? Yeah, but I like cheese, but not cold cheese. It has to be cooked.
you like
melted cheese? Yeah.
Yeah. Cheese salad in brown.
Right. How are you doing?
Okay, hopefully you have some good news for me.
I do have some
Oh,
good
that's
news
great.
for you. Okay, so when you came in last time, I think you saw one of my colleagues, Charlotte, and she started you on a new tablet to try and help bring your sugars down. How have you found the new tablet?
Great. It worked exactly as it said it has.
Okay, have you found you're going to the toilet more often to pass water? How are you managing with that? Are you a driver for a living? Is that
No, I'm a
right?
caterer.
A caterer, sorry. So your blood sugars, since we checked them last time, have come down slightly. As you know, the test that we do here measures your average blood sugar over the last 3 months. So before you started that tablet, you were averaging about 8.6. And ideally, we'd like an average reading, if you're just on tablets, about 7.5 isn't bad. And it's come down a little bit to 8.2.
Okay.
So it's better, still isn't quite where we would like it to be.
I've also lost a fair bit of weight as well.
Oh, fantastic. How have you done that?
I had the really bad flu.
Oh, okay.
And I wasn't particularly ill, I was just lethargic and didn't feel like eating or drinking.
You're right, you've lost. From August to now, you've lost over a stone.
Yeah.
1 stone and 2 pounds.
And I could do with losing another stone around my waist.
Oh, you've done well to do that.
My weight's not really distributed on my legs or my arms. It's
all there.
here.
Oh, that happens to me as well when I put on weight. How do you feel about insulin and going on to insulin?
If I have to, I have to. I'd rather exhaust every other avenue beforehand.
Tell me your concerns about going on to insulin.
It's less easy to use than tablets, having to actually inject.
But would you mind if I just showed you what the pens are like?
I've looked at them online,
Oh,
I've
have
seen
you?
how they work. And,
Okay, fair enough. Why don't we, in that case, your empagliflozin dose, you're on 10 milligrams. You seem to be tolerating it really well. Why don't we increase it to 25 milligrams, which is the maximum dose? See you again in 3 months, and then if it's come down to 7.5, brilliant. If it hasn't, we'll talk through our options then. Is that all right?
The insulin now is nowhere near as much of a problem as it used to be, is it? The ways of doing it. So thank you for your concern, but honestly, I won't have a problem with it. Really,
normally I have to persuade patients, so I'm kind of going into my default mode, but you're fine with it. It's fine. Right, so we're going up to 25 milligrams on the empagliflozin. So you can just start this from tomorrow when you would normally take your 10 milligram one, take the 25s. And that is
that's lovely. Thank you, Doctor.
Nice to see you.
Okay, nice to see you as well.
Take
Bye-bye.
care. Bye.
Hello there. How can we help?
I've been having lots of problems now and then, itchy, and it's now 3rd time I've got this. Last time they didn't prescribe me anything. When I went to chemist, they says, no, you're over 65, we can't give you.
Okay. I think what would be helpful is if I have a look.
Yes.
To see the skin of the vagina and see what it looks like and see if we can try and... No, I know, I'll be really careful and we'll use a small speculum. And then I'd like to take a swab, which is like a cotton wool bud.
Yeah.
And we send off to the labs and it will help to tell me whether or not it is thrush.
Okay.
Yeah? When did you finish your periods?
Oh, long time. Long time.
And did you suffer with menopausal symptoms?
I never had one.
No? Wow, you're lucky, aren't you?
I'm like my mom.
But I'd like to have a look first. Come on then. Right then.
Yeah.
So, are you married?
Of
yeah.
course.
How many years?
About 50 something.
Really? Wow.
Yeah.
I'll have been married 15 in 2 weeks. That feels like an achievement.
Yes.
Yeah. I'll just pop some of that on there. Right. If it's too much, you must tell us.
Yeah. You can see it's all sore.
You look really dry. Oh, ow, that looks so sore.
Yeah, I know.
I don't think this is typical of thrush.
The boarding season starting next week.
Fair play.
And I don't think I'm going to be very good at that because of the pain in my legs.
Oh, no. And you've got to keep doing the stuff you enjoy doing. That's really important.
I walked upstairs the other night and my knee cracked.
All right.
I play badminton. I can't play badminton with my leg.
Have you had any kind of sporting injuries before?
Yeah, my arm on my finger, on my wrist.
And then didn't you get kicked in the ear by someone else when you were playing football?
Yeah.
Yeah.
I could ask you what your golf handicap is, but I wouldn't.
22.
22. What should I say? Oh, that's very good.
Oh, I used to be down at 12.
Oh, wow.
I told you Luke's got trials for Yorkshire tomorrow.
What, for rugby?
Yep.
Oh, wow.
Karen, I'm so excited.
Right time, Dr. Khan. How can I help?
The last time I had this, I was in hospital for a day.
All right, what's this? What are we talking about?
The last I remember what they called it was sinusitis and a severe viral infection.
Okay, yeah.
I've been coughing for over a month.
Yeah.
and it's not shifting. Every time I cough, it's either one of two things. I either get like, I feel like I'm rattling my brain.
Yeah.
Or I'm really just about to throw up, or my chest is really hurting.
Okay. Does it keep you awake at night?
Last night I only got about 2 or 3 hours because I was just coughing half at things.
Yeah. And how are you feeling in yourself?
Tired.
Yeah, you look tired.
To put it nicely.
Okay, right. I'm just going to have a look at the letter from the hospital from when you were in there as well. So they did something called a CRP, which is something that stands for C-reactive protein, and it goes up in any kind of inflammation anywhere in the body. And normally we expect it to be below 5. So yours was 124.
Yeah, mine's always horrible, and it sounds daft, but when I seem to get something, I get it sort of properly and things like that. I mean,
yeah, you don't do things by halves.
No, I mean, a few years ago I dislocated and I broke my shoulder.
Oh, right, okay.
And
how did
even
you
then,
do that?
just playing rugby.
Right.
And what they turned around and said, right, well, I'll give you, like, you know, they're meant to have like about 40, 50 milligrams of morphine.
Stuff, to put it back in.
Yeah, I ended up with 140.
Right, okay. And you've had a broken nose and a head injury. Is that all from rugby as well?
Yeah.
Have you given up rugby now? Are you still playing?
Yeah, no, I've given it up because, unfortunately, the team, you know, we'd all disbanded and all of us were getting old.
Oh, fair dues.
So,
old?
yeah.
You're younger than me. Come on. Right, so if you just sit forward for us. Right, and some breaths through your mouth.
Anytime I do a deep breath,
Yeah, I can hear it.
keeps that.
Have you had any pain in your chest at all?
I can't say no, but no, that's not bearable.
Right. So when I'm having a listen to your chest, you have got some crackles, mainly on that right-hand side, but you've also got something called a pleural rub. So your lungs are covered in 2 layers of a lining, and often when there's an infection between the layers, rather than kind of inflate and deflate like they should with air, they get stuck together, and then when you breathe in and out, it rubs like that. And that's what I can hear when I'm having a listen. That sometimes can cause a bit of pain in your chest as well, so that's why I was asking about.
I always seem to get it on
that.
my chest, though.
Yeah, which is unfortunate because you don't smoke, you keep yourself healthy with sports and stuff. But I think you are right. I think, and it does say very clearly in the letter that if you do get this again, to give you some antibiotics, and I'm gonna go for that as well. I'll give you the same ones they gave you in hospital, the 500 milligram ones. Is that all right? Yeah. Anything you'd like to ask, Joseph?
Can I have a month off?
Why don't I give you a note for a week while you're on these antibiotics as well? Right, one of these 3 times a day for a week. And then your note for work is for the same length of time, and hopefully you'll feel better. Within a couple of days, you should start feeling better with that. All right, Joseph.
My boss will love me.
There you go.
Oh, thank you.
Cheers,
right,
mate.
thank you.
Take care. Bye.
Cheers.
So you look dreadfully sore and red inside. Yeah. I don't think this is typical of thrush. I think this is more likely to be the natural ageing process and the fact that without oestrogen, the skin starts to thin. But unfortunately, water and soap are both irritants, especially soap.
I don't use soap, water.
No.
Just cold water.
So it might help if I give you some Dipro-Base, some moisturising cream to use instead of soap. Okay. So we could give you some of that. Yeah. So pop it on yourself before you get in the bath or in the shower and wash it off. But also some vaginal pessaries with oestrogen in them. Yeah. And I want you to use them every day for 2 weeks and then twice weekly.
My daughter says to me, Mom, you have to go to doctors, you're suffering. So I said, okay, I'm going today.
So these oestrogen tablets for the vagina, they are a bit like a hormone replacement therapy.
Okay.
And some people worry about the safety, don't they, of hormones in hormone replacement. But we know that these are really safe. Very little is absorbed into your system. So they're perfectly safe to use.
Okay.
And I'm going to give you a ring in a few weeks' time and see how you're getting on.
Yes, thank you very much.
Okay.
Yeah. We need doctors like you then.
I need to write down...
We do. Even Dr. Khan, he's lovely. We don't want very serious doctor.
No, we
then
try not
patients,
to be too serious,
because patients get more scared of that.
Yeah, that's right.
And your blood pressure goes high. Yeah. Anyway, really nice to see you.
Yeah, nice to meet you too. Have a good day, won't you?
Yeah, okay, thank you.
Bye-bye.
Bye.
12 and 13.
Number 10 and 11.
Anybody got a ticket?
Number 4, please. Oh, my voice is going. Number 1, number 2.
Number 8.
2 and 3.
14 and 15, please.
Oh, it's like playing bingo.
Hiya. What's the matter, young man?
It started yesterday with just headache yesterday, wasn't it? Pain in his neck.
Right.
And then as time went by, it just got weaker and weaker and weaker.
Okay,
And then high temperature.
Right.
And it was really sweaty. And it was
Right.
38.6. Hopefully I've got it down. It feels a bit cooler.
Yeah. And what do you feel then, Bradley?
I felt like couldn't like really walk.
Couldn't walk.
So are you achy all over?
Yeah.
Where? Just arms and legs?
Well, my legs.
All right.
He was complaining of pains in his stomach.
All right.
Around his belly button area going into the sides.
All right. And is he eating okay and gaining weight and normally
he's
quite
very
active?
fussy eater. He'll only eat certain things. I know.
What do you like?
Fat food.
Fat food. Have you got a sore throat or anything like that?
Yeah.
It feels sore, does it?
Really like I can't really like shout. I can only like whisper and that.
All right. Any rash anywhere?
No.
No, not seeing anything. You're checking.
I'm
for
over
that.
checking, I
Are you?
think. Yeah, over checking. As soon as he was
Let's have
like
a
that, and he couldn't.
Yeah.
And I thought, oh.
You're worrying
I
about
panicked a
him,
little
were you?
bit.
Just check.
First, I thought I've just been treating him for like a viral, and I thought.
Yeah.
But then, as hours went by, he was just getting worse and worse, and I thought.
Temperature's okay
That's
at the
all I want
moment.
is,
Open wide for me. And then go and put your tongue right out for me. Right outward.
Stick tongue out.
Stick. That's brilliant. Yeah, and say now. You say now? Okay. That's fine. And then just stand up for me. And let me have a listen at your chest. So listen. There we go. Deep breath. And what's your waterworks like? Weeing? Is that all right?
Yeah.
Just went about 8 o'clock this morning, I haven't been since, but
Right.
I'm trying to get as much water as I can get down him.
Yeah. You're doing all the right things.
Yeah.
I think at the moment it probably still is a viral thing.
Right.
And I think it's likely to be another 24, 36 hours and then start calming down. If he gets lots of symptoms, high temperature, or a worsening sore throat, such as a tonsillitis, then obviously come back
Can
if
he
there's
still
any...
get tonsillitis with no tonsils? That's one question a lot of people ask me, and I'm going, well, I don't know.
No, not usually. Has he had his tonsils out?
Yeah, yeah,
well,
yeah.
you're sorted, aren't you?
So
you shouldn't get that.
Oh, I had a bug.
I think you've caught a bug.
My stomach was like really like rumbling, and I didn't think.
You haven't eaten nothing, have you?
No.
No fat food. It's fluids all the way for the
it's
next
a bit dry, yeah.
1 to 2 days. And I suspect you'll just start to settle down sort of tomorrow
Brilliant.
afternoon onwards.
Oh, so
Is
I
that
was
all right,
sort of
mate?
right this morning when I said, come on, we'll treat you for this viral.
What does that mean?
Meaning it's just a viral thing that you catch it around, everybody has it.
Nice to see you.
Good lad. Come on then, we'll get you settled. Oh, we need to take that. Not getting rid of that quick.
See you later, mate.
Right, thanks.
Okay,
Thanks a lot,
cheers.
love.
All the best, love.
Oh, you too.
See ya.
Bye.
Bye.
Everything else is perfect, Mr. Jones. Yeah, I wish all my patients were as easy as that.
There you go. Hopefully that will sort you out.
Okay. Thank you. Thank you. Take care.
Bye.
Bye.
Thanks very much.
All right, my love. Bye-bye.
Bye.